Okay, go ahead.
Hey everybody, thanks so much for joining us today. My name is Cristina Monaco and I am the physician assistant that gets to work alongside Dr. Allenby. I'm so blessed and grateful that we are going live today and that I can show you guys one of my favorite areas to inject with the new Restylane Kysse. So I hope you can hear me with two masks on and my shield, but this is how we are treating patients. We want to make sure that everybody is safe and staying healthy. And so I hope that you can hear me okay. So we are going to be injecting on my lovely patient here today, Restylane Kysse. I know you guys are so excited about this, so am I. I've been getting a ton of feedback and a lot of people want to know the difference between, let's say, Restylane Kysse and another product. You have had your lips done, right, Lori?
Yes, I have.
Okay, so in the past, what have you tried?
Juvederm XC.
Okay, so a lot of people, myself included, have had Juvederm. And if you guys are not familiar what Juvederm is or Restylane Kysse, these are hyaluronic acid fillers. Hyaluronic acid fillers, what they will do is cause volume in the area. And so when people want their lips done, a lot of the times it's for a few reasons. They feel like their lips are dehydrated, so they have lines or grooves. They feel like their lips are getting smaller. They just want fuller lips. Or maybe it's because they feel like they're losing its shape. Now, Lori has a beautiful shape. I don't know if you want to come around here and see. Lori has a beautiful shape to her lips, okay? And we were talking before, there was one area in particular that bothered her, and we were talking about that. But for the most part, she has a really nice shape to her lip. Now, when I inject lips, one of the biggest things that I hear all the time is, I don't want my lips to look fake. I don't want them to look like, ducky. I don't want them to look huge. And we get that. I think one of the best things that Dr. Allenby and I, there's so many that we agree on, but one of the things is that we want all of our patients to look natural, right? We don't want people going out into the community and looking, not like their normal or natural selves. We just want people to feel like a better version of themselves when they leave our practice. And so when I treat lips, it's very important that I explain that we don't do, I can speak for myself, I don't do half syringes. So people always ask, I just want a half a syringe and I just want my top lip done. I don't do that. That will give you a ducky upper lip. Or some people will say, well, I only want my bottom lip done. Bottom lip done is better than just having the top lip done because of our natural ratio, our natural proportion. We want our bottom lip to be slightly bigger than the top. And granted, some people do have a naturally bigger upper lip without even having filler. So sometimes it's not just about giving somebody full lips, it's about really having the lips proportional. And I know, again, proportionality is something that Dr. Allenby and I really talk to our patients about, not just with the lips, but all over the face. So when our patients come in for a consultation, a lot of times they'll hear us say, we want everything to be proportional. Our brains like proportionality, right? They like the way things look when it's symmetric. So with the lips, it's no different. So why Restylane Kysse? Restylane Kysse is going to deliver not only a fuller volume and look, okay, while staying natural, but what we find sometimes is that the lips could look almost as if they're hard. Over time, some fillers can make the lips look like they don't move or that they don't have any rigidity to them. So Restylane Kysse is one of the newer fillers that is going to not only deliver with its volume, even though it's going to stay natural, it's going to give a soft look, as if there's nothing even in the lips, as if the person was born with lips like that. And then the last thing, which no one really knows this because when Restylane Kysse came out, it was during COVID, and so we are just getting acclimated with injecting it, meaning that it was supposed to come out during the time coronavirus was closed, so we don't have a lot of injectors seeing this because we're just injecting it. But longevity Longevity is important because a lot of people will say, how long is this going to last? Is it going to last longer than others? Studies that the company has done shows, yes, it will last longer. But in my opinion, we're going to have to wait and see when people start coming back for their follow-ups. I think on average, lips will last anywhere between 6 to 9 months with a filler that we've used in the past. So maybe with Restylane Kysse, my patients will say that they're going to get 9 to 12 months. We'll see. So that's really it. That's what I wanted to talk about Restylane Kysse. And we're going to actually do the injection now, which I'm really excited about because I love injecting. And what we're going to do is stick to our use of cannula. So if you want, you can come alongside me. That's totally fine. And we're going to stick to our cannula use. And the reason why is because cannulas will deliver less bruising. We know that the lips are very vascular. So I always say to patients, risk of bruising is common, risk of swelling is common, and it's nothing that ice or arnica or anything like that. You could take arnica a few days before, and icing will definitely help. If you're somebody that takes Motrin or Advil, it can increase the bruising, and it can prolong the bruising. So just keep that in mind. Cannulas are great because they're a blunt tip. So if I were to take this off, this is not sharp like a needle, and so it bypasses the vessels, but still there's a possibility that there could be some bruising. Okay. Any questions? No?
No
No.
question.
Just make me look pretty.
Okay. All right. All right, so you can put your head back for me. So we're going to start with an opening. Pinch, I'm sorry. And this is what tends to hurt. Does that hurt?
Not really.
Good. So we spoke about this being an area that concerned her. You okay?
Mm-hmm.
And so I wanted to address that first. How you doing, okay?
Yep.
So the product has numbing medicine in it. And we did also give her some numbing before. Are you doing good?
Mm-hmm.
So when we started, her upper lip was definitely a little bit larger than the bottom. How you doing? Good?
Mm-hmm.
So I wanted to make her bottom lip, and we only did this side. I wanted to make her bottom lip a little bit bigger than her top. How you doing, Lauren? Good?
Good.
Great. So the best thing too about cannula is that once you make one opening, I'm doing this so it gets a little numb. You don't technically have to do more than one. Turn to me. Any questions? Anybody saying anything?
Somebody asked, what is she getting? Which,
So we're doing Restylane Kysse. How you doing, Lori?
Good.
Need a break? Very good. Do you need a break? Very good.
Mm-mm.
Beautiful. So one of the good things too is that we can see on this side how it kind of was starting to turn down a little bit on the corner, and just naturally by filling her lips, she got a, on the top, we got a little lift on that corner, so that's great. And you can see it's not overdone, very natural. And she has a beautiful shape to her lips. You okay?
Mm-hmm.
Smile. Beautiful. Very nice. Here, I'm gonna give you.
And my hands
You
are
know
sweating.
us. Okay, so maybe can you want to zoom in a little bit so you can show everybody what this looks like?
and if you want to speak up a little bit, Christina.
Oh, sure. Sorry, my face was turned away from the camera. So if you want to zoom in a little bit so you can see. So she had a really nice shape. This is really just like maintenance for her, but you can see compared to the other side how much more rounded and fuller the top lip looks. She already had nice full lips, so we're really just doing this for a maintenance. But so far it looks beautiful. Are the lips getting numb?
Oh yeah.
Good.
At least this side's really numb.
Yeah. Oh, that looks beautiful. So I'm going to do a little bit more down here to kind of give you a little bit more of a fuller pinch. Okay.
Mm-hmm.
How you doing? Okay.
Good. It's warm in here, but
You okay?
Yep.
You feel okay?
Yep.
It's the lidocaine too. It is warm in here. Alright, so what we're gonna do is we're gonna finish up, okay? And thank you everybody for joining, and I'm gonna show you the after effect. Or the after result. Thanks so much for joining, you guys. We're gonna finish up here.